Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and NewsChannel 5.
Good morning, everyone, and welcome to the broadcast today. Phenomenal Woman magazine is a free publication geared to women here in Northeast Ohio. Founder and President Bibb and Managing Editor Shelley Shockley are here to tell us more about this bi-monthly publication. Then later on, we'll hear from the Chief Operating Officer of the Visiting Nurse Association of Ohio, Terry WEWS. She'll talk about the services offered by her organization. And later on the broadcast after that, we'll hear from the Director of Wellness and Recovery at Recovery Resources, Steve Morse, and Director of Strategic Implementation, Jennifer Tooley. They'll explain how heroin use in Northeast Ohio is being addressed. Good morning again. I'm Leon Bibb, and this is Kaleidoscope. And so we begin with Bibb, who's seated on the right, who's founder and publisher of Phenomenal Woman magazine, and Shelley Shockley, managing editor of Phenomenal Woman magazine. Good to have you here.
Thank you for having us.
Tell me about this magazine. What is Phenomenal Woman magazine?
Well, Phenomenal Woman magazine is a magazine that we try to promote and feature women that are phenomenal in Northeast Ohio, tell their stories, and in return we hope that our readers will learn from that and be encouraged by their success stories.
Inspiring stories out there.
Inspiring stories, yes.
How long have you been publishing the magazine?
Well, we started in 2012, so we are now entering our third year into publication. We print every other month. We're a bi-monthly magazine. We come out 6 times a year. Yeah. Yes.
Shelley Shockley, you're the managing editor. That's quite a job. You've got to get the ink on the paper.
Yes, I do.
You've got to get the pictures in the magazine.
Correct.
Tell me about that. What it takes to do that?
What it takes is just what we're doing here, conversing with people, communicating, learning about the community, seeking out individuals that would be good fits for the magazine, deciding who fits what theme. We utilize themes in the magazine so that it surrounds a specific theme for a month. We do diversity, we do health, a lot of things that affect women. The bottom line is trying to highlight, promote, and educate women throughout the city of Cleveland and the Northeast Ohio community.
Yeah, so you're looking for stories that kind of highlight
yes.
These phenomenal women.
Phenomenal women,
That's
yes.
what you're looking for. You brought a couple of copies with you, I know, and we're going to get a shot of those. We'll put those on the screen if the control room will work with me on that. And these are your cover stories. Tell me about what you're looking for. What readers want to know about people. There's our good friend Marsha Maccabee. She's going to be on the broadcast with us in just a moment. What do readers say they want to read about?
Well, I think our readers want to read about women who are accomplishing great things, not only in their jobs, but with their families and the community. And that's what we're trying to showcase, that you can do, you can have a job, you can have a family, and you can contribute to the community and still enjoy life. And we offer tips on how you can do those things without fairly seamlessly.
Yeah, yeah. Is this what you had in mind when you founded the magazine in 2012?
Yes, I always wanted to do a magazine that is focused around women in the Northeast Ohio area. I've been in publication, me and Shelley, we go back when we used to work for the Colon Post newspaper, so I've always been passionate about doing a magazine geared to women.
Yeah.
Yes.
Where can we find copies of Phenomenal Woman magazine?
Our magazine is freely distributed throughout the city in the greater Cleveland area. We have it in all the public libraries, Cuyahoga Public Library, Cleveland Public Libraries, YMCAs, YWCA, and hospitals, local businesses. We also have a digital version in our website. If you go there, they're all freely available. All edition is digitally available as well.
We are seeing much more digital use on magazines.
Yes.
I still prefer the magazine in my hand, although
Yes,
I subscribe to newspapers and magazines and they come digitally, but I still like to hold that magazine. What is it about holding a piece of paper in your hand or a magazine or a book? What is it about that, you think?
Yeah, it's a good feel, you know, you're at home relaxing and reading the magazine, because people nowadays, they'll say, you know, when I first started, they were saying that you're really crazy to do that because, you know, paper media is, you know, really going out of business right now, but people still do. There are some people that are still would like to hold that magazine and relax at home with their cup of coffee and read it, you know. And so, yeah.
You've been looking over my shoulder. That's how I actually enjoy my magazines, with a cup of coffee and maybe a Danish. Shelley Shockley is managing editor. Let me ask you, what can the community do to support you and your effort with Phenomenal Woman magazine?
Number one is spread the word. Grassroots and people to people is still the best way to learn about things. So tell your friends about it. Share the magazine. We'd also love for you to get your own subscription. As Bele has indicated, we're available freely, but we can also come to your door. We will mail those out for a small subscription that just covers the cost of doing that. And also share with us who you think is phenomenal. It does not have to be someone of notoriety. We have phenomenal women whose names we don't know. The majority public doesn't know. You know, I had a phenomenal woman in my life, and most people don't know her name.
Right.
But she was phenomenal to me. So
she was a building block in your life.
yes, she was.
Indeed.
So
Shelley Shockley, managing editor, Phenomenal Woman magazine, and Bibb Wanwason, founder and publisher of Phenomenal Woman magazine. We appreciate you being on the broadcast. There's a phone number on the screen, 216-702-0845. You can get more information on everything we're talking about, or you can go to phenomenalwoman.me.
Yes.
Phenomenalwoman.me. More information on all of that, and you can find the magazine. It's a good
Yes,
read.
indeed, yeah.
Thank you so much for being on the broadcast.
Thank you for having us.
It is my pleasure to be with you, and thank you. I'll be right back in just a moment. This is Kaleidoscope. I'm Leon Bibb. Back in a moment. Welcome back to more of Kaleidoscope. I'm Leon Bibb. I'm glad to have you with me today. The Visiting Nurse Association of Ohio provides a wide range of services. Chief Administrative Officer Terry Wims is here to talk about the mission of the organization and its programs and services. Chief Administrative Officer, Visiting Nurse Association of Ohio. Hi, Terry.
Hi, good morning.
Good morning, good morning. Tell me about the mission of Visiting Nurse Association.
The VNA is a long legacy of caring for people in their homes. And that's really our mission, to make sure that people get the care that they need in the place that they call home, that brings them to optimal health and independence.
That's important for a lot of folks, to stay at home as long as they can.
Yes.
If they can.
Yes, very important. If you ask almost any person, their preference is always to be at home.
I know your organization goes all the way back to 1902.
Yes.
So was that part of that philosophy back in 1902 when we began?
Yes, it was. Actually, Visiting Nurse Association was one of the first public health nursing organizations in the country in going into people's homes and really not just providing nursing care, but taking care of the whole person, ensuring their safety, nutrition. Our nurses back then, if they saw that a family had no food in the home, would take food.
Yeah.
They would go back later and bring food.
So those are among the services that you provide. Give me a little deeper look into some of those services that are provided.
We provide skilled nursing care, medical, surgical, people dealing with chronic diseases, people just getting out of the hospital post-surgery, the full range of therapy, physical therapy, occupational therapy, speech therapy, private duty services, hospice at home, wherever people call home, and mental health nursing. So we help people bridge from inpatient mental health facilities to their home.
How big of a handprint are we talking about here in Northeast Ohio? How wide an area?
While we just started in Cleveland, we now cover 33 counties in the state of Ohio.
So you've got we got 88 counties. So we're working on about a third of those counties.
Yes, about a third of Ohio.
And who's your primary clientele?
Our primary clientele is anyone who is considered homebound or having difficulty getting out of their home to receive health care services. And it's really anyone from, we have quite a number of veterans that we care for who have paralysis and need 24-hour care. We care for young persons with chronic diseases as well as the elderly. If you looked at our population, probably the bulk is the elder population.
Now, when the nurse comes in the house, what happens when a nurse, in a typical situation, what would we see going on?
We would see that nurse coming into the home, assessing the situation in the home, the safety of the home, how the person lives, and what specific needs they have, not just their specific health needs, but any other needs that that patient may have, or that person may have. So it really is looking at the whole person.
Who would qualify for this? What do you need to do to be qualified for it?
Any registered nurse, licensed practical nurse. We have home care aides, therapists, really any licensed or skilled healthcare provider. Social work.
Yeah. What about the clientele? Somebody out there who says, maybe I'd like to have a visiting nurse Association of Ohio nurse come by my place. What does that person need to do, and does that person have to be in a certain situation?
The person should contact their physician, or they may call us directly. The insurances will cover in most cases, and we would just need a physician order to cover the insurance services.
You've been doing this for some time now?
I have 6 years.
Yeah. What do you like about what the Visiting Nurse Association does, and how does it impact your life? What do you get out of it?
That's a great question. I love what we do for people and their families, and I love the compassion that our people bring to those families.
Yeah. Are there volunteer opportunities out there for people who may want to work as a volunteer?
Yes. Volunteers, we use them specifically in the hospice setting. We do have hospice services as well, but we can use them in any capacity that they're willing to give.
And I can tell you the hospice setting is so vital.
Very much so.
It is so vital. My mother went through hospice, and I had an uncle who went through hospice, and other family members. It was just absolutely I don't know what the word I can use is, but it was very comforting, not only for my mother, but it was very comforting for the rest of the family.
Yes.
So the Visiting Nurse Association is involved in that aspect too, at the end of life.
Yes. And really we can care for people at all phases of their life. End of life is very special, and people think of it as, I think some people wait too late to get involved with hospice, but it's so beneficial to the entire family, not just the patient, and helping him through that challenging time.
I'm going to ask you to give us a final thought on all of this in our final few seconds, but I want to get that phone number on the screen, 877-698-6264 or vnaohio.org. It's at the bottom of the screen there. Take about 15 seconds. This is vital. This is important stuff we're talking about, right?
Yes, it is. It is. It helps people and families deal with challenging situations and getting through them related to their health.
And the changes in life.
And the changes in life.
Okay. Many thanks, Terry WEWS, Chief Administrative Officer for the Visiting Nurse Association of Ohio. Many thanks for being on the broadcast.
Thanks for having me.
Yeah, and thank you for what you do.
Thanks so much.
All of you over there. The VNA.
Thank you.
Okay. I'm going to take a break. I'll be right back. We're going to talk about an epidemic of heroin in Northeast Ohio. But first, these words for you. Welcome back to more of Kaleidoscope today. Recovery Resources provides addiction and mental health services to youth and adults. Director of Wellness and Recovery, Steve Morse, and Director for Strategic Initiatives, Jennifer Tooley, are both here to talk about the organization's mission. They'll also explain how they are addressing heroin use here in Northeast Ohio. Good to have you with us.
Thank you.
Steve Morse and Jennifer Tooley. Steve, you're Director of Wellness and Recovery at Recovery Resources. Tell us exactly what Recovery Resources does.
Recovery Resources is celebrating its 60th year in Cleveland, providing outpatient mental health and addiction services to citizens of all of Cuyahoga County.
And you provide a variety of services with that, don't you, Jennifer Tooley?
We do. We sure do. We have everything from addiction counseling to mental health counseling, psychiatric services. We provide prevention services in the schools. We even do a lot in the criminal justice system, providing services in the jail.
Sadly, we are seeing an increase of drug use across this country.
We are.
Certainly in Northeast Ohio, but across this country. And you've got your hands full trying to deal with this, right?
We do, in particular with heroin. There has certainly been a significant increase in the use of heroin across the state, and we currently have a specific program geared to treat an opiate addict.
Yeah. Steve, when we deal with this, somebody who may be addicted to heroin or some other thing, it not only impacts the life of that person, it impacts all our lives one way or the other, doesn't it?
It certainly does.
Tell me about that.
Family would come first, of course. The effect on the family can be devastating. The community as a whole has to spend money on either treatment or jail or prison. There are premature deaths, obviously, that affect everybody. So it's a devastating, has a devastating impact.
How do people get in touch with the recovery resources? What is it that you do when you take a client in?
Well, before we take a client in, there is something very important I want to make sure we talk about, and that is prevention. Because if we can prevent a person from ever taking drugs, then look how much we save for that person and for everybody else. The governor has a program called Start Talking, which is in schools and working with parents. And we are at Ginn Academy and at Shaw High School making sure that kids know how serious this is and how they need to stay away from it. When the problem does occur, however, we hope it doesn't, but if it does occur, we have, as Jennifer said, programs available to help people get off and stay off drugs, both treatment, direct treatment, medically supported treatment, residential, sober housing, etc.
All those things are vital to doing the work that you need to do with a growing problem. I mean, I know you're concerned about heroin, but we see all kinds of addictions out there, from alcohol to cocaine to heroin and everything else that's out there on the street. What must a person do? Must that client get to you, or can you get to that client, or do family members call? How do they get to you in the first place, those people who need help?
It's a great question. So certainly somebody could call us on the phone because they are concerned about a loved one and ask about the services that we offer. But ultimately it does come down to the individual agreeing to enter treatment. So upon entrance to Recovery Resources, we have trained clinicians that would meet with them and do a full assessment to really get a picture of what's going on and try to determine what type of treatment the specific person needs.
Yeah. Let me put a phone number on the screen while we're talking about that. It's 216-431-4131. You see that at the bottom of the screen there. Or you can go to recres.org. That's at the bottom of the screen as well. Steve, what are some of the reasons people give for not receiving the help that they certainly need?
Well, there are many reasons. One of them would be the stigma surrounding both mental illness and drug addiction and alcoholism. People are ashamed. People try to act as if nothing is wrong or they can handle it themselves. There are, unfortunately, shortages of treatment availability, which makes it sometimes difficult for people, even when they have decided to seek help, to get what they need.
There's no magic pill that you can give. You try to get to the root of this person's addiction. Right, Jennifer?
We do. We do. It would be very easy if we could just give somebody a pill to make everything go away, but unfortunately that's not the case. So it does require a lot of individual and group therapy and support systems and support groups out in the community to help the person learn how to live, we refer to it as living life on life's terms.
Okay. I appreciate you being on the broadcast. We're going to have you back because this is such a wide-sweeping problem that we've got to deal with in this country if we're to find our footing again. Steve Morse and Jennifer Tooley, both with Recovery Resources. Once again, the phone number is 216-431-4131 or recres.org. More information on everything we're talking about.
Thank you.
Thank you so much, Jennifer.
Thanks for
Thank you so
having
much,
us.
Thank
Steve.
you.
Appreciate that. I'm going to be right back in just a moment. Marsha Maccabee, the Urban League, after this. The Morning Exchange segment. That means Marsha Maccabee of the Urban League of Greater Cleveland, who has always got a comment on what's going on in the life and times of Marsha Maccabee and the Urban League. Hey,
Oh,
Marsha.
wow. And it seems like it's all interwoven, by the way.
Well, that's a good thing.
That is a good thing. That is a good thing. You know, the folks were here today from Phenomenal Woman magazine, and I just wanted to acknowledge the wonderful job that they do in really interviewing and bringing forth a number of women who are doing great things in the community, and I'm so humbled and honored to have been one of those individuals who is actually featured this month, and just very thankful about that. And so, you know, they talked about, though, how they want to bring forth women who are working and doing things in their community and have families and so forth, because it's an encouragement for women to see that you don't have to be just one focus or single focus, that you can be multifaceted. Now, the thing that I chuckled about is when they talked about people making it look seamless. I don't know about that because, you know, to strike that work-life balance is really a challenging kind of a thing.
And you've had to do that for years.
Absolutely.
I mean, you're a professional woman,
Yes.
wife, and mother on the other end.
Right,
So.
and grandmother now.
So it's walking the balancing beam, just
Exactly.
and staying on track and making
Yes.
sure one doesn't pull the other one away.
Exactly, exactly. And I think that understanding what the right order of things has to be, because when home is right, it's a little slice of heaven. So, you know, ladies, I know we all know we want to keep, that's a high priority, keep home right. Because when that's right, then the rest of the stuff can follow.
If mama ain't happy, nobody's happy.
You know, I have that little
Do you put
saying
that
on my refrigerator. When mama ain't happy, nobody's happy.
There's a lot of truth to that, I'll
There
tell you that.
certainly is.
Okay.
Yes.
I think we'll leave it at that. We'll
that.
leave it there.
We'll leave it at
Everybody
that.
knows what we're talking
Yeah,
about.
exactly. But, you know, it's a wonderful time, and this is, you know, things that we should think about as we look at this season.
Okay. Gotta go.
Kaleidoscope,
Take care.
A weekly
Bye-bye.
public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.